Our return to learn plans are on our website, and this information was sent out to families as well as staff, and we can kind of go in there. So we kind of go into that district level return to learn. I'm not going to read this because I know that many of you read it. Essentially, we were taking a look at a lot of information as far as, okay, what's the best guidance that we have and what can we practically do within the four walls of our schools. And also noting that a lot of that guidance changes and evolves over time. So what can we do to protect our students and staff in situations where it's not possible to socially distance? We use the term a lot in the plan about strongly encouraging masks. And so that was the partially in response to some of the information that I'll dive into. Actually, I can click over to it now. I thought I could. Give me just a second. There it is. So in our parent survey, we had about 2,200 responses, which was a really good response rate considering we have about 6,700 students and it went out. Obviously not inclusive of everybody, but enough that we can probably extrapolate that information out to get a kind of a good picture. Again, this was sent out the last week of June, closed after July 4th, so we had a good week of gathering data. So of that, the support to return was your data. You're seeing strongly support, somewhat opposed, strongly opposed, that distribution. One of the things we found really interesting, maybe not surprising, was that my child will wear a mask. We had a 50-50 distribution on what felt like at that time a very polarizing topic. Again, knowing what we knew at that point in time. And so knowing that, one of the pieces was just about, we're going to strongly encourage it. We feel like it's something we should do, especially in places that we can't socially distance, et cetera. So that kind of helped inform our initial plan on the reopening. Lots of information in here just with regards to how we might be able to zone buildings, shutting down water fountains, those kinds of things, understanding that while on buses we're probably not going to be able to socially distance. We want to encourage people, if they're able to bring their kids to reduce that load, etc. As much as possible, we're going to have the bus windows open. They'll be disinfected before and after routes, and we're going to, again, all the drivers, aides, and that kind of stuff will be required to wear masks on there. Students strongly encouraged as it's written inside the plan. Health services had a lot of information about screening symptoms, so our intent is to send something out each evening, at least for the first several weeks of school, in a text message format to families. Hey, here are the signs and symptoms. If you display any of these, stay home. And that also talks a lot about, in ours, is we're getting rid of any attendance incentives, perfect attendance, outstanding attendance for students and also staff. Because we want people, if they have symptoms, if they don't feel well, stay home, get it figured out. The resources are here if you have what we consider COVID-like symptoms, how long you would be out, etc. How would you get back in, what happens there, all pretty much laid out. Also, links to the Johnson County COVID-19 testing sites as well as Indiana sites. Reducing risk of transmission, obviously, probably something we should have always done. And will, I'm sure, in our certain future is talk about that what we can do to help prevent the spread of germs and viruses and that sort of thing, with lots of opportunities to sanitize hands, wiping down desk materials, etc., as best we can, particularly if we're in now period, but anytime we're in the future in a cold and flu type season, limiting shared supplies, all of those kinds of things as well. Trying to minimize opportunities for people to congregate. As well, what we can do to manage passing periods so that's not happening. And each building then, and their individual buildings, are kind of addressing those individually. Certainly elementary is going to look different than middle school, going to look different than high school. But the intent's all the same with regards to trying to minimize that as much as possible. Give each other space. The 6 feet in many locations in our buildings isn't really possible, but give each other the space that we need, that we can, and then also highly encouraging the masks as well. Food service, food service with their Safe Serve programs do a phenomenal job anyway. They do that just as part of what they do, but they also will be doing a lot with regards to the face coverings, as well as the first several weeks of school in K through 8. They're just going to pretty much put food into the bags if they can. Kids will get 1 or 2 options for an entree, and that way there's less line, less time in line, that sort of thing. High school, there will be a few options, but we're really kind of limiting some of that to try to go ease of use and try to get those lines going through much more quickly. You know, there's a lot of questions about what if and when, and I don't think it should be what if, it's when we have positive cases. We already have positive cases, okay, in our school community. Okay, we are informed of those. Our staff has done a nice job of informing us of those. It happens in their family, etc. We've had families that have done that. Once the school year starts, the health department will inform us of school-age students who've tested positive as well. Okay, and then we'll work with them. They will do a system of contact tracing and try to identify close contacts, and then within those close contacts, how that quarantine or isolation needs to take place, and then follow that lockstep procedure of how to get out of that phase. What isn't necessarily in the health department doesn't do is close contact to close contact, because that starts to get a little bit outside of the spread, etc. But I know that those things they're going to happen, and we're going to have to be as fluid and as flexible as we can be as those things go about, working directly with our county health department. They're the ones that are going to steer that ship. They're the professionals, and we want to lean on them to do that. And so then there were questions about, you know, how long is the school closed if that's happening, etc. Again, that's kind of in their realm of what their recommendations are and what we're able to complete. For example, if they require, you know, the building to be cleaned and these areas to be cleaned and sanitized and disinfected, etc., it's going to depend on the breadth and the scope of that. It could take us overnight. It could take us 2 or 3 days, just depending on how we're directed by them of what needs to be disinfected, sanitized, and that sort of thing. So we have identified, we're looking at a kind of a cleaning team, if you will, that would be deployed in a certain area with the manpower to get it taken care of in a quick timeline. So again, these are just kind of the things that we've put through there. We also have to be cognizant of individual privacy with regards to their own rights as far as the medical and the health. And so we have to walk that line as well, which is why we have a central point of contact for anybody who feels like that that needs direction on what they should do next, and that's Lisa Hudson, our school corporation nurse, and she has the direct line and direct information to the county health department. Okay, that way we have consistency on how those regulations and protocols are being conducted. So that's kind of our district-wide plan with the individual plans. Like I said, I don't want to read them to you and get into anything in specific that we want to go about and doing. We talk in here a little bit about the, at the building level, is the virtual options and how to request those. And I think we referred to about having documentation, requiring documentation. And so initially, and even now, we want to know kind of the why, because we want to be able to reach out to families and understand how we can best meet their needs and potentially their concerns going forward. And so when we talk about documentation, we've developed a couple of different forms, and it's a matter of, okay, if it's a medical thing, can you get us some medical documentation from your physician? If it's a family medical, just somebody to sign off on it. If it's just simply, I'm really concerned, we want you to sign off and let us know that too. Okay, so it's not a hurdle, a hard barrier to get into or to take advantage of the virtual, and Mrs. Pfeiffer is going to talk about what that looks like at each level. As of right now, we're looking at about 60 students at the high school, about 85 students in the middle school, and about 140 students at the elementaries that have, inquired about a virtual option for next school year. So that's important for us to know. That's something we're pushing out. We try to get our hands on what that looks like in order to know exactly what we're planning going into this semester as well. Ms. Pfeiffer, would you like to just kind of talk through a little bit what those connected learning, virtual learning, e-learning would look like at the 3 different levels?
Sure. starting, like Dr. Spray said, we have developed documents to help principals with that. So when our plans direct that, please call the administrator so that we can further understand. And then based on the information that we receive, we know which letters to provide them so that way they have a quick and easy link to a letter and can help us out there. So those are available. As far as the numbers go, we had 230, I believe, responses to say they were strongly opposed to coming back to school, and we're currently sitting at 289 that chose virtual. So I think, you know, we're measuring up to what some of the survey says, but of course we have to think about the number that took it versus the number we have in the district. Next piece to that would be elementary. They are making decisions based on obviously number and makeup of the school. So if we start with them, each particular school is going to use a similar setup, but depending on how large or small the school is, might make a difference there. We want to try to narrow the scope of which teachers are Zooming with the students, but the goal will be that we want to keep them obviously in pace with their same age peers, because we do know that we will come out of COVID and they will be back in school, and we want to keep them as much on the same curriculum as we can. So we will have a Zoom option where they will be provided a link, and then for the 90-minute reading block, math block, and writing block, they will be incorporated. We're still working a little bit on what related arts may or may not look like, but now we have the 4 pieces picked. On schools that have one team of teachers, we are specializing in grades 3 through 5 in all buildings except 1, which means that specializing means that one teacher would have that group for 90 minutes of their reading block because they're teaching reading all day, and then the math teacher would have them for 90 minutes for the math block and then writing. So that would rotate. If the number got a little higher in any one grade level, then we might move them to 2 of the 3 blocks that day so that we don't have a super large number in any one class. They will have a homeroom, and they will stay with that homeroom because we're really focusing on having the expectations for the district the same for the Warrior Way that you're hearing a lot about, so that we can really roll out PBIS with a great focus this year. We want them to know and be able to do those things, which it will include our 3rd Warrior Way expectation is be safe. So we've included all the ways to make sure we're taking safety precautions under that, so it'll be in the student lessons K through 12 to start the school year. So we do want them to get that as well because they will return. And speaking of return,
Can I ask a clarifying question, just to make sure I understand? Is that now, or can I do it now?
Yeah, absolutely.
That's okay, I wasn't sure the
Good.
format. So I just want to make sure I picture it right. So if I have a 3rd grade student that's working virtually, they'll have a whole classroom full of other Zoom students, and the teacher's working just with the Zoom students, or are they working with a classroom of students and I'm on Zoom?
right, so the goal is to let them interact to the best of their ability so they feel like they are a part of the class. We clearly can video those things and have them optional later on, but we really want them zoomed in so that we're able to count them for attendance that day and we know that they're there and they're completing their work as well. So when it comes reading time, then with the link, we did a lot of this when we were out in the spring as well, and they would tune in and they could see the exact same lesson going on with all their peers. And if we did talk to a table mate, then they would have someone that they could talk to. They also would then be able to attend reading group because the computer basically would just move where it needed to move to be.
So they would be zoomed into their classroom,
Okay.
not in a Zoom classroom.
Okay.
That makes
Correct.
sense.
We want them to be able to still establish relationships with their peers and know who they are so that when they do return, which we know that the majority of them will, even yet this year, that they will know and be familiar.
Yeah, and certainly our experience in the United States right now may not be exactly the same as other countries who've started school and that sort of thing, but we have worked with our research partner at EAB to talk about what that return to learning looks like and what it looks like in some other countries. And what they have seen as well, at the beginning, many families chose to do virtual. They were back in the physical schools within 30 days. But again, it may be different here and there, but that's kind of some of the information that we're receiving. And so, having the kids zoomed in or connected to, especially at the elementary levels, to the classroom that they'll probably return to, felt like it would make more sense than having them completely separate with a whole virtual different instruction.
And are we trying it all to
Yes, can you just turn it back around? I'm sorry.
sorry, Kimberly, you're just gonna have to deal. To limit the class sizes for those teachers that are doing Zoom, so we're gonna make sure they have a little smaller class, they'll be juggling.
Absolutely. We're monitoring those numbers, and if there would be like 5 students in a class, but they're on virtual, then that teacher would have 5 less, because when they come back, they would be
Physically there.
yeah, exactly. We are going to make it very fluid at the elementary level, which means that if they start virtually, but if they want to come back after a week, that's fine. If we get the call, we'll just say on Monday, absolutely come right back and you're ready to go. If they call in a month, bring them right back. The documentation we're asking them for covers an entire semester, and so we won't need any other documentation until the simple one to indicate second semester, because right now, the information that we have says that we're going to still endure this through the fall.
So if I fill one of those out, that doesn't mean my child has to stay out for the semester.
No, it just covers it.
I see, okay.
It was, the reason we did this is just to help that paper trail and not have people passing documentation all the time. So we'll get it once, it covers the first semester, if they so choose to stay out that long. But if not, they can come back at any time.
You're talking elementary.
At the elementary level.
Thank you.
Yeah, we had to differentiate a little bit for different things. So that's elementary. For the middle school, we are looking at a little bit different option than where we started. We started with the students kind of having a core group of teachers in 6th grade, so 1 language arts, 1 math, 1 science, 1 social studies, and doing what you were asking. But then as the numbers have continued to grow, when we looked at even support services, so students that are of differing ability levels and classes that they're in and things like that, it started to be a little problematic with the supports that we have to offer. So Mr. Reinhold and his staff are recommending that we leave the students in the current schedule that they're in. They're in their 4th year of 1-to-1, and so they feel really comfortable with Google Classroom and some other tools. Plus, they have a tech integration coach that's in the building with them and can really work to prep them and be supportive of them. And so they are going to work to use Google Classroom, which they already use on a day-to-day basis, and the students are familiar with that. They're also going to use Zoom. Could be similar to what the elementary is doing, or they may even do for all students, whether they're in class or virtual, a flipped classroom where the lesson is recorded, everyone is watching it at night, and then that day, it's just work time. And so the teacher's available not only if they're in class, but also if they're virtual, to be able to tune in to be able to get their questions answered or work through things with the teacher. So lots of options there. As far as the middle school goes, on return, we are also going to be very flexible with them as well. So again, the letter would cover the semester, but if they call us and say we're ready to come back, then we would obviously allow them to come back in due time, or whatever seems best. If they call on Thursday, Monday, whatever, we'll do that. The middle school, the only caveat there, we do have some students who take classes for high school credit, and the high school has a little bit different plan. And so when I tell you about their plan, that would apply to the middle school kids taking that. So some 8th graders would have a little bit difference, and I'll go back there. So let's go ahead and go to the high school plan, and then I'll tell you how it affects the middle school. So the high school plan is honestly the most simple of all, because we already have had online learning for students trying to recover credits, or students that just wanted to take additional classes that they may have had interest in for different diploma types and things like that. So we're going to use the exact same thing that we have been using. We're going to use Apex, and some of those classes fit our needs very well. Those that maybe we felt like didn't have the appropriate rigor, we've already taken care of bumping up the rigor in some of those courses that we needed to. The only exception are going to be our AP classes. We're going to use Indiana Online Academy for our AP courses. We already, in years past, have paid stipends to teachers to help with the Apex courses, making sure that assignments are graded, feedback's given, etc. And right now, we're at 60 kids, and we feel like our current stipends can handle that. If we get to a number that it can't handle, then we'll simply ask your approval to increase some stipends there to be able to support that. We are using the same forms. They will be for a semester. However, at the high school, because of the nature of taking a course, we're going to say that they need to stay the semester in that course to be able to earn that credit. Because moving from an Apex course to the classrooms where we're doing the other pieces, the high school's recommending that we go ahead and as we're working through things, and everything I have right now is proposal, of course. But we want to stay the course with a semester at the high school and keep them in those courses so that they earn the credit that way. But second semester, if they'd like to come back, then absolutely we can do that. They just wouldn't provide documentation for second semester, and we would put them in the classes and seats. So for middle school kids, though, how that's going to impact them is that if they're in an Apex class for high school credit, they probably are only going to have one of those. And so we will put them right in on Monday, but let's say it's a math class. We will put them in math where they would have been in that same period, in that same schedule, because they've been in all the rest of the classes during the course of the day, doing everything the way the middle school has, except for that one, which has been managed for, similarly to the high school. So then how that would work is they would be in class with the other math kids, still be able to listen to lessons, but during work time, they're working on the Apex class, or homework, not necessarily the work provided in class, but they would still have a teacher there being able to assist them.
So if a high schooler decides to start the semester doing Apex and then in September says, this is not for me, and we're going to say, well, you have to finish the semester in Apex, do they physically still need to stay home? Or can they come back to the high school and do Apex in like a study hall environment? Or?
Right now, we're going to deal with that on an individual
Okay.
basis because we do have kids right now that take an online class already, and we just deal with it on a case by case. It
Okay.
depends on the nature of why it's not working for them.
So if a student starts the school year, they get sick, they have to be quarantined or whatever for 10 days, does that mean they're out the rest of the semester, or can they keep up with their schoolwork at home and then come back after they're well again?
Right now, we do have students that are out for 10 days due to ACL surgeries or, any number of medical conditions. So it will be very fluid, very similar to that. It's just going to depend on the number of days that they're out, and we'll handle it in that situation. If they're, we potentially, if they're in a period that's already doing something online, depends on what the teacher's preference would be on how they, like I said, we are very Google Classroom driven anyway, and that's where we provide a lot of our information. I can tell you we've grown a lot since the spring semester on how we deliver information virtually. So I feel like with the tech coach at the high school, tech integration coach at the middle school, like I said, well, I can't give you an answer on just here's how we're going to handle it because every situation is different.
But the kids out for just 10, so they
Yeah.
start the year
Right.
in October, they have to go stay at home for 10 days. They're going to connect in through the Google Classroom, stay connected like any other absence. They haven't elected to do virtual for the semester.
Right, they're still going to be a student in class, but we'll handle that the way we did on absences previously. And of course, medical documentation gets an excused absence. We talked, the idea we addressed that today in their meeting. So we would just, as long as we have that, the excused absences can count for that. But we would still handle unexcused absences the way we always have with the document information department. Go ahead. Oh, I'm sorry.
Go ahead.
In all levels, in the forms that we're giving, there's obviously the different ones for requesting virtual. We've always had in schools an opportunity for homebound. There is the chance that a student with an IEP may request to be educated virtually, and depending on their capacity to do what we're setting up, because we are challenged by the Department of Ed and of course ourselves to make sure that what we're providing at home is rigorous and not anything really less than the rigor that we're providing the students in person. But if something medically would prevent that student or others from accessing that, or others, we do have a form for that as well, and that would be considered homebound, not necessarily completely virtual learning. We would be doing homebound from home. And we are differentiating between connected learning, because we are a connected learning district now. So we will have inclement weather and also planned PD days, or, as Dr. Spray said, if it takes us more than overnight to clean a space, we can still provide connected learning on those days afterwards, so that we're not necessarily missing instruction. We can be prepped for that. And virtual would be those that are choosing to do that for an extended period of time like this. So connected, we still have, but virtual is the other.
So what is the health department saying for, say you have a kid in the fall gets a sinus infection, is sick for a month every fall, right? So what are they telling us as far as a test? Like, do they have to go to the doctor every time and get a COVID test? If their symptoms are similar, are we requiring that doctor note every time? Because I know some parents are concerned about the cost of that.
Yeah, so if a kid has a fever,
Right.
then it's a minimum of 72 hours before you come back. If you have COVID symptoms, then that kicks into something else. But for example, if it's a sinus infection, and
Right.
I go to the doctor, which I'm gonna probably have to do,
Mm-hmm.
and in order to get back into school before that 10 days, and the doctor signs off, hey, fever due to a sinus infection, they've hit their 72 hours, they should return to school, the kid can come back to school at that point in time. If it's a fever with COVID-like symptoms, et cetera, they're going to have to be out for the 10 to 14 days if we don't have a doctor's note that says, hey, this isn't a COVID thing, et cetera. And we have all that laid out, and I know in that kind of return area of our health portion of our website, and that's also where Lisa Hudson will help guide those individual parents through, okay, this is what's expected, and the school nurses will do that at that point.
Okay.
So yes, it's going to be very different.
Very
We're
different.
going to have more absences for a longer period of time than we have to do. And, we're going to have to be in contact with our physicians. I mean, it's unfortunate that the reality of where we are. And most physicians right now, I would guess, from what we've seen so far, are going to err on the cautious side and support the 10-day piece.
If we do already have it in place and we'll continue to use it for things that aren't COVID-like symptoms, our nurse can excuse the day that they're going home, and then also an additional amount of hours as well in the next upcoming days. So for like costs that you're talking about, some of that we do already take care of.
So talking a little bit about connected learning and our experience last spring and kind of what we saw, because this brings up a little bit more of another question. So we sent out a survey, the SST team, the principals did, what was that, end of May? We did this.
We finished that.
Yeah, and so we had 323 responses out of almost 400 teachers, so pretty good response rate. So one of the questions was, I feel confident about using technology providing instruction to my students during our current COVID teaching and learning structure. So the vast majority of the teachers responded on a 4 or 5, very positive on that Likert scale going forward. Something that I'm concerned about, and I'll show you in the next chart, is, I had 2 children that finished kindergarten last year, okay? And their teacher did a great job trying to stay connected, the team tried to stay connected, but I know that they did not finish kindergarten in the same spot that they would have finished kindergarten if they were in school full time. And, to be honest, we have some resources that others may not to provide that for my kids. But, one of the things that I thought was interesting as we talked about last spring was the question about, scroll down here, my students are taking advantage of the learning opportunities I'm providing remotely. So the same response rate, hey, I'm doing distance learning really well, I feel comfortable with it technology-wise, but here's a response of, hey, the students, are they taking advantage of it? And so we really have a lot more that's kind of in that medium response, and then several there's like, no, not at all. We know that we had several students we lost in the spring for different reasons. They didn't tune in, they tuned out, they were getting guidance from the state on those things that their grades were going to be hurt, they were going to get credits for their high school courses, etc. I'm not sure what I would have done at 16 years old. I know what I would have done if my parents were monitoring me at 16 years old. I would have checked out, potentially. We had some of that, and so that's one of our big concerns is when we come out of this, what is our gap in learning for so many of our kids, and so many of our kids specifically that kind of checks in those at-risk boxes. And so that's something we want to continue to monitor and understand, that while we felt good about our connected learning, we also identified, there's a pretty significant gap in achievement or connection with our students on a day-to-day basis. And so that's why, again, I try to build the plans that we feel like are going to be appropriate going forward. So I just wanted to share some of that information. Kimberly, did you have
Is there
something?
anything from the state about testing, about standardized testing? Have they mentioned, I know it's way early, but have they mentioned anything about waiving results again or not having them or?
The State Board of Education actually passed that we could give the iRead to fourth graders in the fall. So they've actually increased testing if you wanted to take, which I'm not sure what that would do. But yeah, we're concerned about it. I mean, certainly those test scores are something that we're held accountable for. We've had waivers in the past, hold harmless, that kind of stuff. I imagine that's going to take place, but we've got to find a way. Once we get into school, once it gets the kids here, we're at full capacity, that kind of stuff. How do we address those gaps in learning going forward? You know, some of the CARES Act money that we've received to a point can go towards some of that, but I think we're really going to have to do a nice job of identifying those gaps and being diligent about how we're going to try to bridge those as best we can.
I was just going to mention that on this particular piece, some of the details that we collected at the bottom, it is true we had the students check out clearly, but also some of this had to do with our ability to access what the elementary teachers were providing. So they may have provided Zoom or, you know, a story read aloud and some things like that, but the number of parents that we also talked with, and we had teachers call at the elementary levels, especially in middle of time, to say, do you have the ability to do this? Well, we knew our 5 through 12 did because they have a one-to-one device, but some of them were counting this as how their child was watching Zoom or completing things. So we do know that was a part of it as well. So just not having the availability in the lower grades.
So those K-4 families, you know, if I'm using, you know, my cell phone to do that, when my cell phone goes to work with me, that's not there anymore, and that sort of thing. So we'll talk a little bit about maybe some of our approaches might be in the next couple of weeks to get more devices and how we're able to work through that. I know that we've shared, we've talked, we've discussed, we've had our thoughts and feelings on, you know, too many devices that kids have access, too much screen time, and that sort of thing. But we're in this type of situation that screen is their connection for learning, and I just feel like we need to be the best prepared we can going forward with that. But then also understanding that when kids are in the classroom, primary grades, et cetera, that's different. Having that access. And also one of the biggest things that we are hearing from our own county health department, but then others, is kids having their own keyboard. You know, because this is not a sanitary place on any of our laptops. Number one, because they're really hard to clean. And so how are we able to mitigate that concern with potentially additional devices for other kids so that we're not sharing or reducing that particular touch point? I did want to jump in and talk about some of the data we're seeing across the state and in our local community. Indiana State Department of Health has a great website with the coronavirus data on it, where they'll just talk about new positive cases, number of deaths, totals, total positive cases, total tests, et cetera. And so this is kind of an interesting graphic here that really talks about that statewide positive cases by date. And then they have this 7-day moving average. So this line here is kind of over 7 days. How is that average moving? You kind of see along this within the state itself that we had, obviously, I think he's popping up. So in the middle there, we really started to peak up there early May, coming down, and then we're starting to see a little bit of a tick upwards for the state of Indiana. Now, certainly the state of Indiana, in regards to their data in doubling numbers, isn't nearly what you're seeing in the state of Florida, Texas, and in those areas. But also what's interesting is that you can really drill into then what that looks like in your particular county, in your particular area. I'm not going to go into all of these, but certainly up in Lake County, they're driving a lot of the positive numbers right now, and in some areas. We go into Johnson County specifically. So this is Johnson County positive cases by day. And while you see on the far right of this graphic starting to tick up a little bit there, but we're not seeing a sharp spike, and our overall numbers are what they are. Again, I'm not making any judgments on this. I just am trying to look at the data and compare that next to what I see and hear from the local Department of Health. Okay, so all this is available in the state's Department of Health Really drills down to exactly what's going on in the community. It even talks about, demographics of positive cases. You can drill into the deaths that have been reported by demographic group, the groups that have been tested primarily, gender, etc. And this one is another piece of valuable information that the Departments of Health are looking at are available beds, and particular ICU beds in an area. Now, District 5 is central Indiana, I understand. It's pretty much Marion County and Donut counties. It's not Johnson County specific. So it encompasses a larger area there, but it also will be able to show there's 58% of ICU beds that are non-COVID that are taken right now, 10% that are COVID, and we still have capacity for 31% in those areas. Ventilator use, same thing, that's available in those. And that's a piece of information that they use with regards to their capacity. Because one of the biggest concerns through this whole thing has been our healthcare system being overrun. We're seeing more positive outcomes, even in ICUs and that sort of thing, than maybe previously, earlier in the spring. Again, I struggled in a format like this to really draw direct conclusions with the data, because those numbers can be somewhat, I'm going to say manipulated, but that's not really what I mean. But again, I see what is informing the decisions that our local health departments are making. So if you haven't had an opportunity to take a look on that site, it has some good information. You can, like I said, you can really drill down into some of the specific counties and areas in our state and where we're seeing more and more.
So knowing that like Washington and Wayne have changed their plans just this past week, is that a conversation that our district is having, or are we, as of this week, sticking with the plans that we have? I mean,
yeah, so I'll be honest, Washington Township kind of threw us all for a loop, and including some of our colleagues in Marion County. With what their board had decided at that point in time to start virtually, etc. Wayne Township has pushed their start back 2 weeks, which is about April 12th. Part of that is they were still waiting on some supplies that they were wanting to have in place prior to. So, right now is talking to most of the superintendents in our county, utilizing the data of Johnson County. And then what we're hearing from the health department is kind of sticking to what our plan is, but also taking a look at what can we do to ratchet up the plan a little bit. And so I think those are the things we want to talk about too. What can we do to really say, hey, in response to some of the things we're seeing in the state somewhat ticking up, we're staying a little bit steady here in the county, but also what we're seeing nationally, what are some things we should do to be a little more responsible? One of the conversations is masks. I think responsibly, or I would suggest that we move from strongly encourage to requiring them in certain locations, passing periods, places where you can't socially distance, school buses, in some classrooms if we have teachers who have some concerns, and quite frankly, we spend the first couple of days of school talking and building that community in the classroom. And as teachers are able to say, hey, you know what, this is part of the respect, being safe, etc. In my classroom, I have concerns because of whatever that might be, and let's be respectful of that. The only thing that you run into when you start making that a requirement to be is what's the consequence going forward and that sort of thing. And so that's where it puts people in a difficult spot. And then let's be honest, for some reason or another, or one reason or another, I'm not going to judge one way or the other, it's also become a political issue, mask or no mask. And so we've got to kind of get beyond that a little bit and say, you know what, for our school and our school community to get started, we're going to start there. Everybody needs to have a mask with them in the areas that you're going to be required to wear it. Some have differentiated. Middle school, high school, you're wearing it. Elementaries, you're going to have it with you. You're going to wear it at certain times when your teacher directs you to, and you're in spaces that can't do that. Obviously, we're also going to have situations where kids aren't going to be able to wear masks, be it maybe they have a disability that doesn't allow them, a sensory issue that doesn't allow them, maybe they have asthma or those kinds of things. We're going to have to be cognizant of those as well. Maybe it's not a mask, maybe it's a face shield, maybe it's just, hey, we're just going to have some of those exceptions. But when you're dealing with, all the individuals that we deal with in different situations, there has to be some flexibility.
Mr. Betts, what's the punishment for a kid not having their lanyard? Because whatever it is, it's really effective. With my daughter, she's terrified of not having that thing.
I know what it is, because my daughter got it, it's after school detention.
Mine works with your daughter, but it's after school. For the person, it's usually warning number one and then grandson.
Gotcha. Okay.
So, and the other thing is too, is I think we're going to take a better look at limiting passing periods in some way at the secondary schools. You know, what does that look like? The two buildings were a little bit different in that approach, so I think that's what we're going to visit. Maybe that's trying to get half the kids at a time out. The middle school's a little bit easier to take care of because sixth grade already passes by themselves. They're not in with seventh and eighth grade, so that's a third of the students who are out in the hallways at the same time. And they're also a little more, because the way the building's set up, in order to be able to do one-way staircases, that sort of thing, and how students move it within the building. So those are two things that, you know, this week we really talked about maybe making those tweaks to our plans going forward. And then also, one thing we want to talk about, we can all discuss, is with regards to the virtual, you know, being, making everybody understand that documentation isn't a barrier. It's not a stop sign. It's, we just want the information, we want to work with you, et cetera. If a family chooses to do virtual, they need to understand what it is and what it looks like. I mean, if the high school is like, hey, you're making this choice for a semester, and these are the options to do it. And then, you know, something else that has come up, which, you know, many of us that work in schools thought was kind of, well, no kidding. We've had questions about participating in athletics and extracurriculars while I'm choosing virtual, and it just seems counterproductive to the choice of going virtual to then come back and play on the football team. Or
That was on my list, so is that a no if you're a virtual?
I'm suggesting that's a no.
Can I also add that another reason that we put in that we wanted them to contact their administration if they had interest in virtual? We have never been a virtual district because we've never experienced connected learning. And we just want to make sure that we have the opportunity to talk to them about the expectations because we don't want them to think that some of the things that we did in the spring is the way that it's going to be if they opt for that, because the elementary kids K through 4 are not going to have packets. And we didn't want them to just click a box if we send out a survey and think that that's what's happening and then get disappointed if that's what they were looking for. So that's another reason why we haven't necessarily just sent out a blanket something. When it was sent out, it does say to contact your administrator, and we'll continue to reiterate that. Just go back to your plan and contact them so that we can help you understand what it's going to look like.
I really appreciate that one-on-one support
Yeah.
that those families are given so they can make the best.
It's been a
decision.
lot of work for our schools,
Sure.
but there's not been one parent that hasn't thanked them immensely for the time that they've spent with the conversation.
So for high school students, and I'm thinking specifically like incoming freshmen, I remember like what it felt like when my kid went to like the freshman orientation we had at the end of the year. Did they have that? Was that we weren't able to get that in, right? So that initial,
We do have adjusted
Okay.
opportunities for middle school for their registration nights. We're just doing something similar to the way we organized, come pick up your supplies and turn in your supplies so that it's organized by time, so that we have people social distanced and things as they do that. But yes, we'll have like a kindergarten opportunity to meet their teacher, the things that we didn't get done in the spring, turn in their documents and things like that. We're now on.
Yeah, I meant
So
just
it's-
for like, so, because I think of parents that have freshmen coming in and they're trying to make the Apex decision or not, right? So they're trying to figure that out. And I remember just being overwhelmed by the amount of choices I had for my incoming freshmen, like, so trying to figure out what track they're gonna go on and things like that.
The scheduling.
Yeah, the scheduling piece of it, and I can just imagine, you know, the admin staff at the high school getting just overwhelmed with the individual questions, so.
We do, I mean, there's a lot of questions right
Yeah,
now.
right.
I've worked with principals and allowed them to have an extra person in the office that may not have been there right now at this time to help with that overload of questions. And then also, we're not necessarily having people come in and do person-to-person scheduling, but we're doing Zoom.
Right.
You know, just to be able to just zoom in and make sure that we get face-to-face conversation with you to help you with those things.
Okay.
And like I said, we do have adjusted for freshmen and then middle school registration, and we're just adjusting, doing
Sure.
similar.
And they were already in the process of scheduling eighth graders
Yeah.
Were they
pre-COVID,
before the
so
fifth grade?
a lot of that has gotten taken
taking place. And actually talking to one of the guidance counselors at the high schools, because of those Zoom meetings are actually more efficient on the scheduling process than having individual scheduling the times people come in and what they're losing in the Zoom is sometimes the guidance counselors also like to allow them the opportunity to walk the building and look at the building and that sort of thing. It just wasn't feasible up to this point.
But your recommendation is they contact the high school if they have specific scheduling questions, or, because if they filled out the form for Apex, they'd get a call anyway, right? Okay.
Yeah, and instead of scheduling the appointment and showing up in person, you're still doing the same process, only you'll get scheduled.
Another thing I wanted to bring up today is we have identified a vendor that has 1,200 Chromebooks that we can push go and get to our school corporation with that, and then also the hanging on to the ones we were replacing. We feel like we're going to get really close, and also the ones we have on carts, we're going to get really close to having one-to-one Chromebooks K through 12. And provided, again, we're not asking for a vote this afternoon. We provided I don't get a whole lot of negative, I'm going to go ahead and push that purchase order so that we can get those claimed this evening. Because those will fly off the shelves and have been. I was actually very surprised we were able to find them sitting there. And we will be utilizing for that some CARES Act money. We've also applied for a grant from the state. We don't know if that's going to come through for several more weeks right now. We also have rainy day funds that we could potentially use for that. And we usually build that into book rail as well, but that's something we can work towards how we adjust that in the coming months for those purposes. Which would potentially eliminate that touch keyboard issue at all of our locations. No, it is a $550,000 decision. But I feel like we can make that work and Florida can be responsible as well.
For 1,200 Chromebooks?
Yes. $430 each.
Software case.
And that would provide a Chromebook for everybody K through 12?
That'll fill in the
We're
gap.
filling the gap, K
We
through.
don't already have them, yes.
Right, right. And would those be distributed right away, or in the event that we have to take
We go
everybody
ahead and
virtual?
distribute those once we are able to get them and logistically distribute those. It's not something that happens overnight as soon as we get those. But they would get into the kids, to the buildings, to the classroom, so that those kids can use them. Again, trying to eliminate when, my first grade students have a station to do some stuff on the computer, they know to use their computer to do that. It would also be available for some of those students during the connected learning. We know that there's a good snowstorm coming up, take those home. We know it's planned, or in the event that we would have to shut down a school for a couple of days, all of them would have access to a device to be able to come in. It doesn't, we still have families that may have connection issues with internet. We address some of those by installing hotspots outside of several of our buildings and the parking lots. And we'll continue to work through what we're able to do. We had several vendors this summer that said, oh, we'll provide you hotspots with families and that kind of stuff, but they were all backward 6 months. So it's been a challenge to get some of the resources because everybody's wanting them at the same time.
And I would say that our elementary staff did a phenomenal job prepping themselves to be able to work with the kids virtually. And so if we do have to be out for even a day for cleaning and things like that, if we can get them here and we can get them practiced with them, they would be able to provide those lessons virtually to the kids without phones and things like that. And I do know that it's been a concern of the board before that we don't want the little ones especially having too much screen time, and we will absolutely have a plan to make sure that they know when it's appropriate to use those in class when we're here all the time.
And how to program the blue light filter.
Yes.
So figure that out.
Like filter.
So part of the ratcheting up, as if numbers should continue to increase, so I hear requiring masks possibly instead of strongly encouraging purchasing extra Chromebooks. What about extra bus routes? I know that's a big concern every year anyway, it's how crowded the buses are. Has there been any conversation about adding routes?
We have talked about that.
Our concern is not only the number of buses we don't have, but then we already have a shortage of drivers. We experienced that all last year. So we sort of add routes. Basically, you would be bringing in a group of kids and then another group of kids 45 minutes later. But then you'd also back up the middle school and high school. So since we do multiple tiers of busing, that's a struggle.
Yeah.
We know that's one of our areas of vulnerability. One of the reasons why we're putting in the disinfectant, assigned seats on the buses, so we know that any contact tracing, masking up. Also, I anticipate a lot of car riders, which would be interesting for us as well.
Do we have any idea the increase we'll see?
Yeah, in that parent survey, I think it was an increase of about 15%. I'm just off the top of my head, I can look at it. It may have been more than that. I think it was 11. Okay.
Is there any way to restructure our drop-off lanes at those schools to make it more conducive to get people off the highway and into a lane that's not traffic bearing so that the weight is not as,
I'm sure when we see our reality, we will be making
Yeah.
in-flight adjustments,
Yeah.
for sure.
And do we have enough bus drivers?
As of right now, we feel like we're in good shape.
We have subs just in case anyone gets sick.
We are having, training as many subs as we can find that are wanting to be subs.
Do we feel the need to address the attendance policy at all, or because we're offering so many multitudes to receive learning, is that not something they're worried about?
Yeah, I think we're okay on our attendance policies. I think our biggest thing has to do with regards to, kids being out for that period of time, but we're gonna have code those as COVID days. And that'll be a new code in our attendance if someone's at home, either in isolation or quarantine or whatever that is, we'll work with them directly.
And are we saying a positive test is another code of that? Or,
I don't know that.
okay.
It'll be a generic COVID type of code.
But we're not requiring a code positive test to
No.
say this is what this is
No,
under that.
it walks through in that plan.
Yeah,
If there's a positive, this is what's happened.
Yeah.
If there are symptoms and no test, or if there are symptoms and a negative test, what exactly the requirements are.
okay. And sports,
I was gonna say, I met with Johnson County Probation Department because they're partners with us. And so, especially since we're gonna have some people that are participating virtually, I mean, there may be some different reasons why they're not connecting, even though they looked at the device, et cetera. So, they looked over our attendance policies and things like that. And we're very encouraged that, we will count attendance based on, did you connect in with your teacher on that day, and did you work on your work just the same as you would have in class, and that's considered present. So we talked to them about what we were going to consider present and absent, talked to them about documentation for excused absence, and that we will still stick to, regardless if you're in seats or virtual, the 7 days and 10 days on the reminder letters. When we go to 10, we will still go ahead and use their services to be able to check in with them before they're actually recommended to the probation department with the probable cause piece. So we will use them at all levels to be able to make that extra step. So if they're in class, they're going to do what they've always done. They still will go to the home and talk with the family if they're virtual, just to see, is there a reason that things aren't working for you, and they'll still partner with us. So I just met with them last week to secure that they felt like the way we were going to handle attendance with kids also virtually was a really great plan.
and that's 10 days no contact, right? Like we can't get a hold of them. That's when they would be directed to the probationary.
It wouldn't be in a row.
Okay.
It's just 10 days. It's 7 first for the warning letter
Okay.
of unexcused, which means out of all of our processes and lists of things, if you haven't brought us documentation and provided that call with the proper information, then it has to be counted as
Okay.
unexcused.
You said something about, are we going to say something about athletics?
Yeah, so will the decision about athletics come from IHSAA? Is that a decision we'll make locally based on if we have a bunch of positive cases?
You were with regards to whether we compete this fall or not?
Well, yeah, whether certain sports start, like especially the winter sports, are we taking all of our directive from IHSA on
Yes,
that?
at this point we are.
Okay.
Certainly if things locally start to look
Right.
different, or things look different within our athletic
Yeah,
department
yeah.
itself, we can make those decisions, but most of all, IHSAA, I missed the letter, had a pretty good onboarding process that they walked through, but again, their plans are as fluid as ours.
What does our ball games look like football season? I know it's outdoors and I know but how does that social distancing gonna be addressed during football season?
Yeah, so this is one of those answers where I don't really have the answer, but the reality is that's about a month away, and we know how quickly things can change in a month. So it may be very limited attendance at ball games. It may be 50% capacity. It may be, hey, we're at stage 5 in the state. We're in good shape. Things are starting to come down. I just can't tell you at this point. The kids really haven't started official practice until August 1st, and then wouldn't have any competitions, I think, till that last Friday of August. So there's just a lot of things that change between now and then.
No preseason games like we normally have in football?
I don't think they're doing any interscholastic 7-on-7 and that kind of thing at this point in time.
And then we'll be cleaning the stadium, like we'll be disinfecting after everybody leaves,
Yeah, we'll have to
you know,
yeah.
yeah, because that's a whole nother.
Right, and so, you know, my understanding from Dr. Mormon, who's our county health official, is, you know, he didn't have the same concerns that others might have. I mean, as far as some of the things that were put out from the DOE with regards to playgrounds, that sort of thing, because of UV rays, because of being outside, those kinds of things. So, I mean, just that stadium being empty for 2 or 3 or 4 days would take care of most of those things. Also knowing that facility is used on Saturday mornings and Monday afternoon. So we'll have to address all of those. You know, right now, they're just really hoping to get the green light to be able to do something this fall.
This is really small compared to those questions, but I've seen parents ask about water. Since the water fountains are shut off, should they just bring enough water for the day? I've heard parents say maybe you could bring in a case of water and leave it somewhere. I'm just curious if.
We don't have storage space for everybody's case of water.
Okay, that's what we're
But we do ask, and we've already been shopping in my household for a water bottle to fill and send in for the day. We'll also have some stations available for bottle filling stations.
Okay.
I know that Jay has ordered how many?
We've ordered 28, I believe, across the district, and looking to order more. As far as the
The
touchless
touchless
water,
dispensers, yeah. So,
the problem is they're on back order again.
of course, right,
Everybody's
right.
after them, so we have, I think it's 8 that we have on site currently, and so the maintenance guys are going around installing them.
So that sort of goes to my question. You mentioned a school district that pushed back to me because they were waiting on supplies. So we have supplies of sanitizing wipes and masks and things like that. So when those run out, is it up to the teacher to request more? I mean, how's that process going to be? If
Yeah,
your
so-
classroom uses all of them, what do they need to do?
So we have, and Jay's kind of helping with the operations end too, but we have a kind of a standing, we want to keep 10,000 masks in stock. Okay, as far as reusable. We're also expecting about 8,000 masks disposable. We're expecting a stock of about 8,000 reusable masks for all of our students and staff, et cetera. The state is actually sending some hand sanitizer kits as well, but when we also have a bulk. So so if the high school this week requested 2,000 masks, you know, it's an automatic order to get that 10,000 back up in stock. If we start seeing a difficulty in the supply chain, you know, that changes things a bit. But we're going to try to have those on hand. Hand sanitizer, cleaning agent, that sort of thing we've got a good stock of those, and as we use it, we'll continue to reorder. My inbox is filled every single day with somebody selling something, hand sanitizer, logoed face mask, gloves, all of those things. But, you know, we'll have to respond to the supply and demand going forward, but that's something we've stockpiled as we can. Going back to water, we've also talked about just going ahead and having the cafeteria order additional water, having it there, and then, you know, even, you know, if we need to sell it at 15, 20 cents, whatever the cost is, to recover that on top of having those filling stations on top of those kids to bring them with them. Not trying to make money off anybody on this, et cetera, but having that availability. We also asked ourselves the questions like, all right, how many times does a kid really go to the drinking fountain during the day? I don't know that answer, but it's probably not as much as a 16-ounce bottle of water.
Middle school. So I know a few years ago, we stopped letting middle schoolers have their backpacks. Are we thinking about letting them have them again, just to kind of keep things together, and keep it to themselves?
Yeah, they've reversed some course on that, yes.
Okay. So parents will be made aware of that. Okay, perfect.
What about staff? I'm a staff member.
What was that about the backpack?
Middle schoolers, they're reversing the course on backpacks.
Yeah, so we're
gonna
just
let them-
trying to keep kids, they're still gonna be able to go to their lockers. I can't remember how that was defined in the middle school plan. I think it's actually outlined in the middle school's plan. But getting there, because we want to lessen the congestion in the hallways. And so when you have all the middle schoolers with all their lockers open, that just creates congestion during passing periods. So we've made some adjustments to what was the middle school plan for backpacks and lockers last year when we were normal, and now we're new normal, and what that looks like. There was good purposes, I mean, especially with the amount of, tripping and, or, those backpacks in the classrooms and stuff, that we had to deal with what we know now.
And if we're too quiet, holler back there. We're not, sorry. I didn't realize people could hear.
Staff members that get sick, I mean, are they required to take PTO? Can they try to teach from home virtually?
Yeah, so we're gonna learn a lot of these things. I mean, certainly, and then John Schlosky there has information with regards to, if a person actually becomes ill with COVID, tests positive, et cetera, is under quarantine, those types of things. Federally, there's 80 hours of paid time, and then there's also some ability to use their paid time leave for other purposes, but that would be in addition to their paid time. We have talked about, obviously finding subs and the amount of subs. If we have that going on, it's going to be challenging. Quite frankly, if a teacher is able to instruct their class while they're being isolated, I think that's probably the best thing for kids, to continue to receive that instruction or at least have that resource. We'll just kind of work with that on, as we move through. We don't have all the right answers, but we've thought through those things and I feel like that's probably a good course of action.
I appreciate the thoughtfulness. I know there's not solid answers for it.
Yeah, I mean, and I wish I'd had them.
Sure.
I know that many times when I get calls and emails and all the what ifs, it's a struggle, but we want our staff members to do what's right by them. Going forward, we received some feedback this week, just in big thoughts or concerns about the masks. And, with what we know now compared to the end of June, making those more of a requirement, especially at the older levels where they can manage that, is going to be important. But also realizing that, I myself, with my glasses fogging up and trying to read my computer screen, we're going to have to be, reasonable too.
So the 80 hours they get, is that per calendar or school year that they get?
John.
Yeah, what happens is that it constitutes 80 hours under FFCRA, which is the Families First Corona Response Act.
Okay.
Okay, and then you begin to go into the other scenarios like Dr. Spray was talking about. We have paid leave, medical accumulated
Right.
opportunities to go into.
So this is
non-paid
separate
leave.
from that,
Yeah.
right?
Yeah.
And if they get it twice, if they get it fall semester and spring semester, they've already used their 80, that's all they're allocated?
Yes, they're allocated at 80.
Okay.
And then you also get into the emergency FMLA for other situations.
Sure,
But for
sure.
an ill person, we hope at this point that we do have it covered.
Yeah, again, John has been made aware, and so he's kind of that point person. There's too much for all of us to absorb, so.
Yeah, for sure.
No, so our thought, I kind of shared what our thoughts were as far as some of the adjustments of these plans. I'll get a video out this week to families, to staff. For some reason, those have been fairly well received, I think at times. I try to keep them short as well. Nobody wants to sit down for 30 minutes, especially see me. So we'll try to get some information out of what some of those adjustments are as well. So if you want to open it up to.
Yeah, so any questions or comments that you guys have, it's probably better if you just stand from your seat, and let us know what you need to say or ask, and we'll try to answer as best we can, and we'll go from there. So if anybody wants to, backtrack this?
And, if this was a true, high school setting, I'd have my chair out here, okay? And I'd have the choice to not have a mask. And I think that's disturbing.
Do you know that gentleman?
I hope you guys know each other.
Okay.
But consider, but
Yeah.
this is the purpose of why I did what I did.
Yeah.
Now, does he know that I have COVID? I really think we have to mandate masks.
What we said.
And this distance is a big issue with 30 in a classroom. And my worry also is in the cafeteria, to have that exchange of many kids going in and the tables not being washed. I mean, who's gonna do that? We don't have that capability to wash them down in between each section. I mean, we have to consider that. And then relative to Apex, I have kids that come back and say, hey, guess what? 2 weeks, I passed biology. Awesome. I don't think that's quality. There has to be a different option. There has to be. Thank you.
I have a question. As far as, I feel like there's a lot of, I know, and part of this probably comes from being in healthcare, but, we've sat in front of so many, CDC meetings and you name it, and whenever a question comes up, it doesn't become well, when that happens, we'll deal with it accordingly. And I know when you started out the meeting, you said when, not what if. I feel like there's a lot, we have roughly 2.5 weeks before we start school. There's a lot of uncertainty across the board. And by nature, we're all planners. But when and how are all these policies? It can't, so, a lot of it comes down to just the parental piece of, the classroom setting. And I know you say we'll handle it as each situation, but if Sally's mom, like me, a nurse, gets COVID, do you sit Sally out and the whole classroom out and their teacher out? Then it affects, am I quarantined then for 2 weeks, like as a parent? When are those policies going to be in place on how are we going to handle X, Y, and Z situation? Same with if I have a patient, how am I going to handle when I have to go handle that patient? Because these are not what if situations anymore. This situation's happening.
So the returning after exclusion is outlined specifically, it's on the screen right now, specifically on the website as well. Developed through and with cooperation from the state health department, guidance from the CDC, etc. So that's kind of covered. So what you're asking is who's excluded and when, and a lot of it has to do with those symptoms, etc. And contact with our local health department. So Susie in this room, mom has COVID, okay? Susie obviously is excluded. We asked the local health department, because we know about this, okay, what else do we need to do here? Who are the close contacts? They trace the close contacts, they make those determinations. Okay, those are the local health professionals that we have to work with, etc. It's not something that we can make those determinations on our own accord and be responsible to their guidance and their expertise. And so what you're saying is, okay, if I have a kid whose mom tests positive for COVID in Mrs. Jones' class, is all of Mrs. Jones' class out? No. They're going to go back and they're going to contact trace. They're going to figure out, okay, Are we symptomatic, asymptomatic, is the, who are the close contacts, all of those things, and we'll take that guidance from the health department.
So I think that's for every case, right? Am I
Yes.
right? For every case, they're not going to let the school make the decision on the path forward, the health officials have to. So that's really why, because we could say, well, this and this, and he's like, we can't make that choice. It's not our choice to make, it's the medical professional.
And it's different if, Mr. Jones, the teacher of that class, who's in a lab-like class and that sort of thing, and people weren't wearing masks, and that's kind of a different deal than how that looks. But again, that's why we have to rely on them in all of those types of situations, because then when we have that decision-making tree going through our point of contact as our local health official, which is Lisa Hudson, through the county health department, then there's consistency. And there's also the contact tracing is consistent, which will be conducted by the Indiana State Department of Health.
And then my second question is maybe, I know it was the goal of Johnson County to return all the kids full-time 5 days a week. And I know trends are changing obviously, but if that doesn't change, I know that they did not much reduce class sizes, smaller, because they wanted everyone to be pushed in lack of open rooms, classrooms, is what I've been told. Our classroom sizes are not decreasing unless they have known, it sounds like e-learners, but the classroom sizes are not decreasing. Have we ever thought as a district maybe of, going forward of having additional space? And that way our classroom sizes, if we do have to go back into the classroom, that our classroom sizes, it's already a struggle for the poor teachers. I can't even imagine being a teacher having to do all the infection precautions with such a large class still. Why are we not reducing class sizes?
We're working to use other instructional spaces to spread out. Reducing class sizes also means more teachers in an era of teacher shortage now. And so we're trying to work through all of these things. I get it. If we could do that, et cetera, it would be, more responsive to some of that guidance. We're also giving, people the option for a virtual opportunity as well, going forward. And you're right, our teachers are on the front lines and have always been on the front lines of things.
So I guess my question going forward then is, we're again like 2.5 weeks away from school, and we don't, why, does this influence, I guess my question, does this influence us not having the staff to reduce class sizes? Does this influence pushing back our start date because we need to find more staff to reduce the risk of infection to our students?
I'll look into those things that you brought up for sure.
Perfect, thank you so much.
Go ahead.
Sorry, I was writing.
That's okay.
I have a question about what you said about the masks being mandatory. So first I wanted to say that there is germicidal products that kill the germs for 24 hours on the surface or eliminate a lot of those. Okay. There are students who cannot wear masks. And so when you say out of respect, they should, then you're assuming that my child or the child who has asthma is being disrespectful. And then therefore you're labeling them, and you're going to have teachers looking at them as if they're just not respecting the whole situation, when that could be further from the truth. And that's not fair. So how are you going to prevent the teachers from labeling those kids, like you just said, they should be more respectful and wear a mask? But if they can't, then how would they do that?
Yeah, and being in the back of the room, you may not have been able to hear me very well, because I did also mention that there are certain students that won't be able to wear the mask.
Right, but you already said that out of respect, well, are they gonna wear a sign that says, I have asthma, I can't wear a mask, so I'm not being disrespectful?
No, it wouldn't be any different than the other ways that we communicate medical concerns to our staff in a very discreet way, individually, with the kids, the teachers that kid has contact with. It's the same way we would not put a sticky note or a label on a kid who's diabetic, but some of those teachers that child has need to know that kid's diabetic, or they have certain peanut allergies or something of that nature. We're pretty well prepared to do those things.
But what I'm saying is you've already just thrown that out there already. That out of respect, everybody should be wearing a mask.
Okay. Thank you
So
for that.
that's
I
already-
appreciate you pointing that out because I apologize if that I came across that way. That wasn't my intent.
The other question that I had was, as a freshman mom, we don't know, like, we came from not being allowed to have backpacks to, are they allowed to have backpacks in the high school? Are they not allowed to have backpacks in the high school? Can you give some freshman parents some information? Because everything's changed, so what we were expecting is kind of not what we were told was gonna happen now.
Okay. We will make sure that communication happens with all of our parents as we're opening up school.
Good morning, sorry. I know that you had mentioned, and that I strongly agree with, that if a student chooses to virtual learn, or however we're calling it, that they wouldn't be allowed to, because as you say, it kind of eliminates or defeats the purpose of letting them have contact, sports and being around that many people. At what point will that become a policy that you can't participate in, gather extracurriculars? When will you guys decide that now? Because I think that's going to make a lot of decision in a lot of these students potentially becoming, I know my son, for example, if he can't play football, I wouldn't want him to, but it's going to make a decision on kids virtual learning or not virtual learning and making that decision. So
we need to communicate that. Okay.
So that's just to be determined.
Yeah, I thought we had communicated that.
But you said you strongly recommended it not, like they couldn't participate in extracurriculars if they were a virtual learner. So is that a 100% policy now? Or is that just, because I don't think parents are gonna realize that piece? Because I have a lot of mom friends that.
Even right now, for example, we haven't, the students at the academy haven't been able to participate in those extracurricular sports. But then also our homeschool families have been allowed to participate, but they would have to be in person for, I think it's 3 periods a day was the previous policy. Now we've had to revise that because of the block schedules and that sort of thing. So that's it's been precedent before, but we can be more clear in that communication.
So like at the elementary age, at the elementary level, where is that policy to be found of that your child cannot participate in extracurriculars if they are a virtual learner?
So I think what Kimberly had said is that it's not a policy anywhere because this option to do virtual online school is just new in the next
Okay.
2.5 weeks, right? But if you submit or sign the paper to say, I want my child, no matter the age level, to be at home, the first thing that's gonna happen is you're gonna get a phone call saying, okay, here's what that means. And that means they can't do extracurricular activities. So
That piece has not been, just not to my family, but
Right.
to other moms I know, that piece has not been communicated yet, just so we know.
Yeah, and I don't think it will be unless you sign up.
I'll include it in my video this week.
Perfect, yeah, I think that will help a lot of families decide.
I agree, yeah.
And I will also tell you though, following that as well, that if they're doing e-learning, they can't do
Yeah.
extracurricular.
I think that probably just needs to be communicated.
It says
I will
in
make
here
sure that
the
we get that
elementary level does not
communicated.
go
I will
do
also tell you
extracurricular
that
activities.
Because I personally did not know that. I mean, obviously I wouldn't do that because it defeats the purpose, but
Right,
I personally did not know that.
sure.
we also, at the elementary level, any of the after-school clubs and things like that, we've really kind of postponed those until we get past the peak of this. So there's really not much to participate in after school, but at the elementary level. But I will make sure that that's communicated to our next correspondence.
And that includes like junior football
I was
and
gonna say, yeah, that's,
basketball and the sports as well.
yeah,
The ones that are under the school's control.
yeah, that's,
And some of those
Like our
aren't
community leagues.
really there.
Yeah, so AAD would be separate, right? So that would be on
Those
your
are
own.
private entities, yeah.
Right, but if it's like the,
it's like a Whiteland Junior Warrior football league.
yes,
We
ma'am.
have so much.
Right.
That's not our school program.
Okay,
Okay,
so they
that's
can
Whiteland
still
Junior
participate in
Football
that.
is on their own entities. We don't control that organization.
Okay, good to know. See, these are things I didn't know.
Yeah, so school-sponsored extracurriculars that we own,
Okay,
operate day-to-day, have responsibility, insurance coverage for, et cetera. That's,
well, I think
That's
that
ours.
the Whiteland, we still have to have like IHSAA physicals and all that jazz for Whiteland Warrior Junior
that's
football.
Policy.
Policy.
If it's not
That's
under
how they
White
run.
Athletics.
If it's not under White Athletics, so they.
So I think maybe it's making it clear when that discussion's had with parents, they can do this and this, they can't do this and this.
We don't, in the elementary, we don't have youth sports as the school
We
corporation.
did, okay, got it. Good to know. See, I
They're,
didn't know
they're,
that.
they're
They're
clubs.
close.
Yeah, like robotics club is something that we have, and that isn't gonna start until later, so we're just kind of postponing those opportunities.
Good to know.
So I guess I have a thought when it comes to connected learning, because I had an 8th grader last year and a sophomore. So both my kids will be in high school this year, and I can say that I'm the kind of parent that my kids were up and at their computer when the time started. I monitored all of their homework, monitored grades. That's just what we do in our house. And the rigor was not there. I would ask my kids, what are you doing? Like, you're on the Xbox, whatever, are you done? Oh yeah, I did all of it. And I can check it and see their completion grades. And I have a son who has straight A's, has since forever. So he wasn't deviating from his norm, he's responsible. And he's like, it's just not there. Now, conversely, I'll say, he had Trig, and Trig, a lot of it was taught via screen sharing. And there wasn't that, I guess, extra contact that happened. So thankfully, he's very smart. My husband's an engineer. And so they were able to figure it out. And then he mentored his peers. But I would say that connected learning fell short when it comes to rigor as what they're used to. And then in the classes that are more challenging, i.e. Trig, there was a lack of teacher interaction that really provided instruction. It was really challenging because that's not my forte. So I just would be concerned with going all connected learning, that we really look at rigor. And then I would also say that if we have to go to a reduced capacity to keep our kids in school, I would be really interested in knowing, and I know it would be a nightmare to deal with, but if we could go to blue and orange days, or whatever color you want to call them, and cut the number of students to where we could at least be in the building some. Because I really value the fact that my kids are able to be in contact with professional educators who have their best interest at heart, who are strong leaders, positive role models. And it's super important for me for my kids to be in the building. So that's my 2 cents on that. And I also appreciate you following the very direct and specific instructions that the health department will give. And as a healthcare provider myself, I completely understand the fluidity of the situation, as I've also been on daily, hospital leadership calls. And it's very fluid, and we're not gonna have all the answers. And it's not if, it's when. And that's okay. And it's so hard to be okay with that, but we kind of just have to be. And I trust that you will follow the leadership and direction of the health department to keep our kids as safe as possible. And I appreciate all the steps that you're taking to try to be clean and sanitary, the water stations, masks, etc. Like, I appreciate it.
To go along with what she's saying about the virtual learning, I know that it was thrust upon our elementary more so than it was our high school and middle school. But I had an 8th grader going into high school. And I agree, the rigor was not there. I'm a stay-at-home mom. And I was like, what are you doing? What do you get on there, check out a book, I was spending 8 hours a day teaching them myself, which I'm not qualified to do. I give 100% credit to the teachers because I didn't go to school to teach kids. I don't know the best ways, the best methods. One I have we don't click when it comes to me teaching. One I have that does. The point is, the technology is there. We didn't utilize it. We could have been having virtual classes. They had Chromebooks. It wasn't being used. To give them a YouTube assignment or a video to watch, that's crazy to me. To give them an assignment to watch something from the History Channel that's on YouTube, they shouldn't even be able to access YouTube from those Chromebooks.
Yeah, so I'm gonna, I apologize for interrupting, but I'm gonna stand up for our teachers here for a little bit with regards to where where we were in the progression of e-learning, et cetera. We were set up and going into where we were getting prepared to be able to do what we call connected learning for short periods of time, not for delivering instruction every day for 2 months. That's a whole different thing. We've learned a lot of lessons in that process, and we've had a lot of exponential growth. I hope we don't get back to where we're delivering all-day instruction for months as well. I don't know what the future holds there. But I know that they grew a lot, they worked really hard at it, and we've grown from the process.
I understand that, and I'm not knocking the teachers. If I can finish my thought, the webcams are there. It would be no different than being in a classroom teaching and using the webcams like what? That could have been utilized a lot more to go live with the students than it was. Because yes, they may be checking in attendance-wise, but they're not checking in. They're not checking into whatever it is that was sent to them to do through YouTube or whatever it was that they were doing that day. That's my point. Because that's where you're going to get the gaps in the learning. And for the elementary, yeah, it was upended and there wasn't a whole lot to do. So parents found resources where they could. But we could have done better, and I hope that we will if this happens again. So my question is, what is the plan to keep those kids in K through 4 from falling way behind if we have to open up and then close right back again? Because we had packets. Now she's saying we're not even gonna have packets.
Sure.
First of all, thank you for your input, and as Dr. Spray said, we had been through committee work to decide if we were going to become a connected learning school for this particular upcoming school year. And so but connected learning is for a planned professional development day. And I know I was probably speaking to the front and you couldn't hear me earlier when I spoke, and I apologize for that. Or it's inclement weather, but it's not for more than just a couple of days at a time. So we were making plans for that. When this came upon us, we tried to make the best decision possible, knowing that we didn't have a one-to-one device for our K through 4 students at the time. We did make an effort for the teachers to ask them if they had a device, and we still were able to provide something through Classroom Dojo or other places so we could get connection with those kids, and made that our plan and forte. The survey that Dr. Spray brought up a little bit ago, he didn't show the particular questions, but they are on there. We asked our staff what they felt most comfortable with and what they used the most during that 9-week period, but also we asked the question about what they wanted to grow and learn more about. And we now have just recently added a tech integration coach. We already had one at the middle school and high school. We now have one that will be servicing our elementary school. And we've also gone through the process this summer of deciding exactly, we call it cake and icing. I know that sounds really ridiculous, but what 5 things are going to be a part of the cake, and make sure that every teacher in the district through those tech coaches will know how to deliver those 5 things. So Google Classroom being one of those, and then 4 other pieces that help make it interactive for the students so that we won't have as much complacency. So that will be a piece that will roll out when we get the teachers back and ready to go. And then on top of that, then those other types of programs, like you're talking about, the links and things to other types of programs that we subscribe to for the students, would be things that we teach the staff to use after that if they don't already know. But we have that survey already taken, knowing what they use and when. But we rose 5 more interactive pieces to the top that everyone will be able to be versed in. And the last thing that we're going to attempt to do, we talked about making kind of an emergency call on going ahead and securing the devices that we mentioned a minute ago. We've already made contact with the warehouse that has those. And so getting those so that K through 4 will have a device. I realize we were speaking about it as far as safety goes, so that they are only using their own keyboard, but it is more than that. It's that if we have to be out for a couple of days for sanitization or even a day, We are already connected learning now, so we can roll that out and still do a lesson and all the kids can have a device at home for us to deliver things, as you said, through Zoom and virtually and talk to those kids. So we have the quote, we have that ready to go. We've also written a grant that will be submitted by the 17th to make sure that we have an opportunity to secure funds that will fund those computers, but even if it doesn't, we do have some other finances figured out and prepared to be able to do that. So I do want you to know, in addition to that though, the message we were also sending our staff during that time in the spring, that was a very stressful time. We were very concerned about just the social emotional health of the kids, making sure our families had food, and we did try to help our teachers know that less could be more at that time, because number one, the students hadn't been trained to use those particular devices, and so even if we would have sent them home with the ones who didn't use them on a day-to-day basis, the last thing we wanted to do was stress a family out that we hadn't prepared the students to learn that way from home. So I really do, both of you that spoke, and I know others of you had those same thoughts in the spring, but we have done a lot over the course of time, and we have a lot prepared for the staff to be able to take part in and prepare to do a better job for the kids.
Can I also just ask mention one more thing? It's a lot easier to train and instruct somebody from a book than to not. So I know that my son, for instance, in middle school, there weren't exact books for him to have been sent home with or for us to be able to look at. But it would have helped me help him a lot more if I had access to the books. But I was told there's even an English book for an 8th grader. So I couldn't even try to help him with a lot of the things that he was doing.
So some of our curriculum is digital as opposed to a hardback book. So the things that they have would be usernames and passwords to access that. And then for the most part, they take a book and then put that particular information digitally for us so that it's not necessarily something they're carrying all the time. So I don't know particularly, if you'd want to contact me later, we can look into that. I don't know the specifics, on the programs you're talking about, but that's what we try to do.
It doesn't get easier as they go through high school.
I mean, to have a science book to say, let's open up the chapter that you guys were working on and look at it.
So I guess what I'm saying is, like, the particular content you're talking about, I'm not sure if we had, some of it actually has like chapter by chapter and you just log on and access it and get that information. Some, it's a different type of digital resource, so it would just depend on the class that you were talking about.
That's my point.
Yeah.
We as parents we don't know what that,
Right, and that's one of the things I meant about, because we weren't quite prepped to just hand it over to you yet, that's one of the reasons we're making an effort not to give more frustration to the families and stress them what they were already feeling.
I guess as a follow-up to what I had commented, I just wanted to relay that as a community service system, be it the school or healthcare, we were all behind the eight ball. We were all scrambling. We were all trying to do what was very best for our students, for our patients, for the community. We all struggled. So when I say that, the curriculum reserve wasn't there or the screen sharing wasn't there, it's by no means a knock on any teacher, because I feel like my kids have had a fantastic education. I'm basically forward thinking, because I agree that it's not if, it's when. And so I just want to know that and what you explained is excellent, that we're forward thinking and that we're really looking at those things for when it does happen, that there will be opportunities for, the Zoom contact or something of the sort for the kids to really get that bigger. And I'll also give a shout out over my shoulder here, that there are some teachers that are part of extracurriculars that even when we weren't in session and it wasn't their quote season, they've still taken time to get their kiddos. Sorry, but I'm very thankful.
And I do commend Clark Pleasant in general. As Dr. Sweet, my little guy is a kindergartner and he's got an IEP, he's very challenged, and I will say, the resources are out there, if you know, even the hard book or whatever, the resources are out there, and Clark Pleasant did an amazing job weekly. That occupational therapist did not have to Zoom for an hour with my specific child, but the resources are out there and available, and to be thrown that, the district did an amazing job, and, you know, I want to commend the district for that, for sure. I mean, because the resources are out there, you just have, I mean, you know, just have to reach out as a community, you know, and just, the resources are there, and your staff did an amazing job with the IEP still even, so just know that that's out there, and it was amazing.
Mr. Gay, I know you had your hand up earlier, I know you questioned and answered it.
Yeah, no, first of all, thank you for, I know the last 4 months have been very difficult for you all, and just first of all, thank you for everything that you've done, putting up with the parents who, from social media, are not, hopefully the kids act better than the parents do, I'll say that. But as we talk with our son about whether or not to do virtual training or come back into the physical environment, what is it going to look like from a student's perspective? Is it going to be fairly militant where you are going from A to B, you're not talking, you're not socializing, you're rushed through the day just to get from point to point to point? Or is it going to be a little more relaxed where they will have some social opportunities to be with their friends and interact, or what will it look like from the student's perspective?
I'll just jump in there just for a minute, but that was a lot of the discussion about our planning in general. Just just how tight you open up. You do it where your second grade class of kids never see anybody, but those kids in that second grade, they don't play with anybody else, they don't eat with anybody else, they don't move in the classroom, everybody comes to them, or do you open it a little more loose so that you can tighten things up somewhat? And what's the best? What's the best developmentally? Because one of the big things we hear from health professionals has to do with the social, emotional development of kids and how important that is, in the short term, but completely when we're talking about the long term of development. And so that's a big part. And so we've got to be, cognizant of that going forward. I know that we're not going to be militant and, walk in a straight line and don't pass each other and that kind of stuff at the middle school and high school. Quite frankly, the kids won't go over that a whole lot. But we also want to be cognizant of the fact that we've got to be able to be responsible to know that if, Johnny has COVID, we've got to be able to somewhat and reasonably be able to contact trace who that kid's had contact with, and how can we limit that, and also being able to recognize where our vulnerabilities are. At the elementary, middle school, that's probably somewhat a little bit easier than the high school, but it's also possible in the high school. That's one of the things why we said, in the cafeterias, they're not used to that in the high school and middle school. We're going to have to know where kids sit and who they sit around, who they sit with and around on the school bus, which classes they have, obviously, having assigned seats in classes so that hey, Johnny sat here, and here are the kids within a certain parameter of him. So it's going to be very different, but also recognizing the fact that kids are kids and they need to grow both socially and emotionally, and that's a big part of their development.
Will they be able to choose who they sit with at lunchtime, or will it be a sign that you are,
I don't have that specific answer at per building level, so I would kind of talk with maybe that building principal, but my understanding is once they have a seat, however that's either assigned or that's where they're going to be going forward. Some of that may be different, for example, on nice weather days, because one of the things we want to get kids outside as much as possible, less, potential. So I know some of the buildings are trying to figure out, the high school maybe, how can we use some outdoor seating space when we're dining. Obviously, if it's a thunderstorm, that's not going to be available. But we're trying to do the best thing we can, have some things in place.
And I think we talked about at one time, the lunchrooms like spreading out into a hallway or a gym, depending not if school has space to do that. So trying to get them a little more spread out. Some of those, cafeterias are pretty small.
With the fact that we'll be kind of not totally brown bagging it or anything like that in the cafeterias, but we may have more mobility in how we are able to get that food to different alternative areas and serving lines and that sort of thing.
And we're not necessarily like at the middle and high, there's not silent passing periods or anything. So they're still going to get to pass in an orderly fashion. and talk to friends as they go from point A to point B. We'll just eliminate the congregation of a group of students and just, keep them socializing as they go. The elementary, on the playgrounds, they're still gonna get to play with their friends, but we are gonna zone so that they'll take turns in the zones from week to week or day to day so that, Miss Smith's class will be in that zone. So they still get lots of interactions, but again, so that we know who's occupied those spaces.
If I can ask another question, unrelated, I greatly appreciate the recommendation of the required masks. I do understand that, some people find that more difficult, and hopefully the face shields can accommodate those individuals. But when it comes to, say we don't wear masks or we are wearing masks, there's the high potential for bullying, either for, like she was saying, for people that aren't wearing a mask when it's required, or if it's not required, for people to make fun of people that are wearing a mask.
Or the type of mask being worn. That's where I think you guys are gonna have to decipher. Okay, Sally can't wear a sparkly gold one, Johnny can't afford but just a cloth one. So that's gonna be a challenge when it comes to kids, I think.
Within the first few days of school, we've referenced the Warrior Way and how we've been more consistent with how that's going to be rolled out and talked about, certainly bullying is part of that conversation. And I'm sure in this new normal, that's going to be a part of the conversation as well with regards to, this is what we're in control of and not control of. And quite frankly, types of masks. I mean, I've gone through a whole bunch of different types trying to figure out something that doesn't make me crazy, and I'm still looking.
In the pink shirt, and then I'll get you this one too.
My question's not COVID related, but more parents and social. I know we've got the additional resource officers. What can be done on a high school level for kids vaping, cutting, cursing, horrible social media? I one failed as a parent. I kind of, my daughter got her phone taken away, and what I see other kids posting on social media is absolutely appalling. And I have to think that other parents don't know what their kids are posting. But my high schooler says you can't walk into the bathroom without, kids vaping. And I know there's a lot of kids suspended for it. I know there's a lot of bag searches. What else can we do as a community to fix this?
And that's an even bigger discussion. And I'm not trying to put you off on that, but that's a larger discussion. We start talking about our mental health programs, going back even, like you said, the Warrior Way, and how we treat each other and how we're respectful and what resources are available to us. We did get our first canine this summer, who is a single source dog, which we'll sniff out, and the dog is very good at it, finding drugs, etc. So we're trying to work through. I know our counselors work really hard, our principals work really hard. They don't want to spend as much time as they spend hunting down vape pens and that sort of thing. But it's and also I think a bigger part is, and our mental health coordinator's done a nice job of pushing resources out to families as best we can and making sure we're having those conversations in the families too. So, right.
Is there a way for kids to anonymously report things?
Yeah, we have the tip line on our website to do that. We get several of them. Sometimes it's used for other purposes, but so if a kid, for example, is reporting something at the high school level, it goes to the principal, every administrator at that building, as well as the four of us right here in this building and our police department.
And I'll answer as a mom and not a board member. Something that I've done, and Joanne Matthews is one of those people, is I've just built a community of moms amongst myself, and we have no problem calling the other mom and saying, did you see what your kid, And I've also, I've seen something that a young girl has posted when my daughter was younger, and I contacted that mom, and I just said, you probably don't know this, and she had no idea. Now, I'm not saying it's always going to go great, because sometimes the mom's taking the picture. But, in that instance, she was very thankful for that. So I think as a community, we can hold each other accountable a little bit too, and create that group of moms or dads that can, help to kind of watch each other and what they're at. I mean, it's not a solid answer, but it's helped kind of keep my, my group a little under control, I guess.
Feel free to direct.
Yeah. And you, in the yellow shirt?
Yeah, I'm the teacher at Pleasant Crossing. You guys seem pretty set that masks are going to be mandated, maybe not quite so much at the elementary level, but do you still feel that it's safe then for an entire grade level, sometimes two, to be in a cafeteria with masks off, eating, talking, all together in that space? Because that'll be a time when we'll have, you know, like 200 or more kids moving through with no mask.
I know that in some of those spaces, and I can speak to Pleasant Crossing specifically, is trying to spread kids out as much as possible by using the LGI room, using other areas of the building to try to do that. You know, masks will be asked to be on while they're going through the line and then taken off once they get through those tables, is kind of the general gist of that. I think you could find exception to just about anything that's being taken place right now in our state of Indiana. When you go to a restaurant, you know, are you really safe there, you know, with people and what they're doing? I can't, you know, we're doing the best job that we can and trying to distance kids, get the mask on them, and take those precautions, cleaning the tables and disinfecting them between lunch shifts. I know we've got, you know, plans and materials in place to be able to do it at the middle school and high school as well. So I would say, you know, if you haven't, just work through with the building principal as far as what those lunch shifts look like at that particular building.
And we have extended some lunch shifts if necessary. We didn't have the space to help accommodate. So you may see some lunches shifting in different buildings.
I think purple shirt and then I saw you back there too.
My child is a student at Pleasant Crossing, and we have one custodian during lunch. One. There's over 800 students in the building. Are you going to hire more staff? I reached out to our building principal, and she said that wasn't not going to happen. But I'm just curious. I mean, during the day, there's one custodian in the cafeteria. I know. I've worked there. I've cleaned the floors. Teachers usually wipe the tables if they can before the next class comes and sits down. There's 5 minutes between those. I mean, I know there's going to be staggered times. We're going to move kids around. But are we hiring the staff that we need, or are we dumping it on the teachers who now have 30 kids in their class to make sure, Johnny, put your mask back on, we're lining up, so-and-so quit, you know.
So primarily as we have done school, our cleaning has taken place in the evenings.
Okay.
And we've had less need during the day.
Right.
That has shifted.
Yes.
And so therefore our staffing will shift somewhat as needed in the building. So we directed the building principals, if you need your second shift people to work first shift instead of second shift, you have the authority to be able to make those adjustments in your building. If you need more hands, etc. And then so, you know, is it going to require additional? You know, some of those things we also need to understand once we get things up and rolling. And so we will be hiring additional custodians if they're needed and coming from the buildings, and if they're available.
Yes, obviously.
I mean, yeah.
After breakfast, swept floors. As a PTO member, that's just what I did in the mornings. And I sub in the building, so sometimes I was, you know, obviously if I'm in the classroom, I didn't do that usually. But as a volunteer, I'd be there in the morning and sweep the floors. But while the custodian's taken out, you know, we have 250 kids that eat breakfast in the building, and they eat them in the classrooms too, so the trash cans are down the hallways. So your custodian leaves to get those trash cans, and a lot of times, you know, I'd be sweeping floors, and with volunteers not being allowed in the building, which I totally get. The contact tracing's gotta be a nightmare for that whole idea. I just worry that you're gonna lose, if you're not being cognizant of the fact that the amount of volunteers that are doing extra little things like that, and you don't have staff, it's just gonna be right back on your staff that have, like I said, I haven't heard anything about reducing the class size. My son had 30 kids in his class last year, at third And year. to feed off that,
Has there been a proposal to hire
Just to
X
hire more
amount,
people.
X amount more teachers, and we're 2.5 weeks away from school to reduce the amount of class? I know you said you'd get back to that and you'd find answers. At what point will we know kind of if there will be reduction in class sizes, or how many teachers have we agreed to hire because of COVID? Or I know there's a shortage in that jazz, but how do we, like, at what point will we know, you know, as a community what the proposal can be, that how many extra people can we hire staff-wise, teacher-wise to reduce those classes? Like, when will we know that?
And even support staff would be helpful too, like when you do have situations, like when the teachers are leaving, the next group's coming in for lunch or for whatever. You know, if we can't hire a custodian, so, I know that sounds bad, but I've had kids here for 15, whatever years now. They graduated to high school, they still have elementary kids. Support staff, I mean, they get paid less. It might be cheaper budget-wise to come in and to help with those situations, to help with keeping things clean. You know,
I can tell you on staffing wise, you know, in March, you guys, if you are in a situation where you're trying to hire people for anything, it was a difficult job market because everybody who wanted to work had a job. Okay, that market may be different now. I don't know. I know that we still have positions open that we don't have candidates for, that have been posted, that we continue to try to work through applications. We've got positions that we can or cannot fill because of that. And sometimes, and we are also interviewing at this point in time to see where we are. So at this point, we have not seen a surplus of teachers to hire, but we still have openings that we're trying to fill. So, you know, that's, you know, like I said, people, you know, they will just, you know, hire more teachers and have lower class sizes. It's not real feasible. Now, with regards to the number of virtual options and virtual opt-ins, you know, that's going to have an impact too on that. And so we're trying to do that in the virtual way so that it could reduce those numbers in classrooms, but we don't have those numbers right in front of us as far as what that actually looks like.
Green t-shirt and then the lady friend.
Yeah, thanks. My name is Jake Phillips. I work at the high school. First of all, thank you. I know there are no easy answers to all of these problems, but I have a couple concerns that the way some of the policies are being written or kind of talked about will discourage families from choosing more isolated options. And so, one of those being with online school being through Apex as opposed to with a dedicated teacher, more similar to what we tried in the spring. I think it's just an inferior educational product compared to a teacher who knows the student and works with the student. And I think for that reason, some families who might be inclined to be on the cautious side will opt out and they'll be in the building. Similarly, you suggested that sports might not be an option for students who are wanting to do online school. And I don't quite agree that it defeats the purpose. I think it's not optimal, but it still reduces that student's number of contacts from 2,000 in the high school to 15 on his basketball team or 20 on the soccer team. So it's still a massive reduction. And I think for many students who might want to be at home, they will set aside that option because they can't play sports. And then last, you also mentioned for the attendance policy that as of now, no changes seem to need to be made. And I think, again, similarly, students who might identify certain symptoms will be dissuaded to do so because so many absences from schools have negative penalties for them. And so I just want us to be really careful and thoughtful about the way we write the policies, that it doesn't undermine a student or a family's goals to also be healthy, right? We want those to be compatible. So, you know, good online school opportunities, still being able to participate in sports potentially, and then not having punitive measures for absences based on symptoms or concerns about COVID.
Yeah, so
and I don't know for sure which is right. I just want us to be really thorough thinking about that.
Yeah, so the punitive portion of attendance and with calling in, with having those that's an automatic. I mean, they're getting this. There wouldn't be those punitives for it, and we're also not going to incentivize perfect attendance, outstanding attendance, that sort of thing. You've got to understand when people don't feel well or are sick, they need to stay home. And we also realize that some people are going to play games with that, and we just have to live with it.
Sure.
Can I ask something on the tail end of that though? I am a mom who makes my kid go to school unless they're running with fever. How do we, because there are those parents that say, you're going no matter what, fever or not. Can those kids have access to their classes online that day? Like, can they sign into this virtual system that you're talking about? Can they have the fluidity to do that? Because if they're left to their own to just Google Classroom and trying to figure out their new trigonometry assignment or whatever it is that they're working on, they may not get it, and then they're gonna come back and they're gonna be behind. So is there a way to give them that option to see what the teacher is teaching that day?
So if Mrs. Fuentes has students who are already virtual in her class, and she has that up and that kind of stuff, that's a possibility. But if Mrs. Fuentes has a 4th grade class, and there aren't any virtual kids in there, we're not gonna set that up in that situation for a 1-day or a 2-day absence. Now, if the kid has to be isolated, quarantined, something like that, that's when we'll kick in and start doing more with the virtual for that. But as far as a 1-day or 2-day absence, we're gonna handle that as we have in the past. It's just not feasible to ask our teachers to do that on a daily basis, in and out, and know exactly which kids are in and out.
Would you be able to speak to the Apex versus the connected learning we attempted last spring, as well as the sports situation? Dissuading students from being online and at home because of Apex being less effective than having a teacher, as well as precluding them from playing any sports.
You just brought up that topic, I can't speak to that right now. I'm gonna
Okay.
think about it and talk
Yeah,
to my
that's
about
fine.
it.
Okay, thank you.
I just wanted to clarify the mask thing. I know that you said that you're suggesting maybe mandatory for middle school and high school, but not necessarily elementary. Is that what you're saying, or?
We're gonna have to figure out what that grade level cutoff is.
Okay.
I don't think you can't ask for my kindergarten, 1st grade, and 2nd grade kids to wear a mask the whole time they're here.
Right.
They're just not gonna keep it on. They're gonna be messing with it, they're gonna have their hands inside of it, they're gonna be blowing their nose inside, you know, all those things that we have kids at that age. And that then puts that burden onto the teachers. We've gotta figure out what is reasonable in those and developmentally appropriate. Having one with them and able to put it on and that sort of thing, absolutely. And asking our parents to make sure that their children have one, have practiced with one, know how to put it on, take it off, where to store it when it's not on. You know, all those things are things we as parents are gonna have to prepare our kids for the school year.
My other concern is, I know that you mentioned 3rd through 5th will be moving classrooms. Is that correct? Sorry, I'm talking, I don't know what your name is. Yeah.
Kimberly.
I'm sorry. So I guess I'm concerned about that because I feel like it's just as easy for them in 3rd through 5th to stay in the same classroom and, you know, have one teacher. I know it's not ideal, but I know that teacher's qualified to teach all the subjects. So I'm wondering why you decided to have them move classrooms instead.
Well, I didn't necessarily say that we're moving classrooms.
Oh, okay.
The teacher may move.
Okay.
Those are things that we're still working through at this time. They're specializing just to teach a content. So reading, math, or writing.
Okay.
And then they would have their students for the rest of the day. So it would just be a move for if they move. We're working on that building to building depending on what the classrooms are
Okay.
located.
And I did ask the principal about that, and she said that they would be moving.
And then thank you. We'll do it.
So I guess I'm
Organize that.
concerned that's a lot more exposure. You know, a kid sits here, and then she said they'd be wiping it down, and that's taking time out of education to clean every 90 minutes. And that
Thank you for that, and we'll discuss that during our continual revisit to our plans.
And that
thank
makes
you.
a lot of sense when you do contact tracing to trace one adult versus tracing all of those kids, especially in that environment when you could easily have the teacher, you know, who.
Well, just to talk to that, because I'm a 4th grade teacher at their school. I was one of her kids' teacher. My resources are in my room though. So like, I wouldn't be able to go to the math teacher's room and have my books and
What's the
have.
philosophy behind like having the reading teacher and the math teacher and the, like why do that? What's the philosophy behind that?
I mean, that's,
I feel like we're getting into a different topic with that a little bit. I understand the movement of kids, and we'll kind of work through the principles and try to address that and minimize that as much as possible. But as far as the instructional philosophy on the why and the expertise in that particular field that we're trying to cultivate, you know, I think let's agree that maybe we can have those conversations at a later time. Because I do feel like we're kind of getting later into the evening with trying to respect everybody's time a little bit as well.
were you done, Mrs. Breyer, with what you were going to say just about your materials being?
Yeah, I mean, a lot of it's going to be able to be accessed online, but like handling books and things, we have had a lot of conversations between my teammates and our principal about like how to handle books going home and things like that. And they'll have like a quarantine bin, and then we'll have the ability to clean them. We've talked a lot about cleaning our spaces and how, I feel like the transition times are gonna be amped up a lot, and that worries me a little because it impacts, I'm sure the schedules that are gonna be handed to us are, detailed and have been a nightmare to make, like I cannot even imagine that. But I mean, I think our stress level is high.
One more. Does anyone else have any more? Because I'm going to get this on and then we'll be done.
I know this is probably a silly part of this to ask, and it's probably like this isn't happening, but I just want to clarify. So I'm assuming there's no other extracurriculars happening for the school. Like, are we having like homecoming dances and like, fundraisers and like fall party? Are we going to say that that's just not happening this year, or is there?
It's not happening at this time.
Yeah, I mean, that's what I just wanted, like,
We
is
don't
that
have
everything?
we don't have a timeline on it. We just have to see how things develop and move.
Right, so that's why, and then like, I know you said clubs are kind of postponed like for a while. Are we just saying like, except for like athletics, basically there's nothing else we're gonna be doing at the schools? Is that kind of the guideline?
Yeah, without the middle school principal and high school principal now in the room, I don't want to make a broad sweeping statement on that because there could be some clubs that could still happen, but by and large, we're going to try to minimize as much in our school buildings as possible, at least for the first 30 days.
Well, I appreciate it. I know the board does too. Everybody coming out and taking 2 hours of your day. We all have some stress of going back to school and a lot of decisions that need to be made. I just ask that you communicate with your teachers or the principals, and let's have some grace for the staff when they get started, because it's stressful on everybody to try to do the best thing. But if there's something that impacts the safety of your children, I know the people in charge want to hear about it and want to try to mitigate that risk. So I appreciate everybody being here, and our next board meeting is in a couple weeks, so come on back.
Just a couple quick reminders. Graduation scheduled for Saturday at 11 a.m., rain date Sunday at 11 a.m. So trying to get that taken care of as best we can. And then also board members, it's kind of late, but we are hosting a lunch tomorrow for our food service staff and those who are doing deliveries at 11 a.m. at the middle school. If you happen to be able to come by and say thank you. Again, it's something we're trying to coordinate with those folks who've done an exceptional job this summer getting meals out. I think our low point in the whole summer was 882 kids coming through in a day as far as getting meals for, and our high point was almost 1,200. So it's been pretty consistent throughout, providing almost 10,000 meals a week.
I wanted to give you guys like a round of applause for that. Seriously. You guys made sure that a lot of kids feel that to eat. Yes, no matter what.
And it's good, the kids like it.
Yeah, and for some kids, just to see a smiling face, right?
Yeah.
To see that adult that they might miss, and so I think that's.
But there were a lot of schools that didn't go that step.
They were
And you guys did.
Yes.
And awesome job.
Yeah, they definitely did. And you guys also didn't have stipulations on district. You didn't have to live in Clark Pleasant schools to get those meals. Because I had someone reach out, they live in a different district and they ran out of food. And I was like, well, my school doesn't say anything about having to have teachers' names or anything like that. And so they were able to go over and get meals for their kids. The lady babysat, so she was able to get lunches for the other, because those parents were hoping, that's how they paid her. It really helped. We didn't have those stipulations on those parents, and they really, at a time when they really needed it to just be easier.
And the delivery part was fantastic,
Yes.
especially for parents who could not.
Yes.
I literally emailed him one day and that, Saturday night and Monday morning, he had him on the schedule, so.
I was very.
I appreciate it very much.
Very helpful.
Make sure they know that.
There's a couple of drivers in this room, so thank you guys.
Thank you guys. Appreciate it. Okay, well, we're adjourned, and our next board meeting is in a couple weeks.